All right, so my name's Mark Stoller. I'm a pathologist at the University of Virginia. I've been there 25 years, and for some of the people on this side of the room, pathologists are the people who help people like Dr. Brennan and Dr. Shammy and Dr. Sherman and others in the room diagnose cancer. So when Dr. Brennan sends a patient, he has a patient with a lump and does a biopsy, he sends it to me to tell him whether it has cancer. When Dr. Shammy takes a sample of the pancreas or Dr. Sherman takes a sample of the colon, what they're doing is cutting off a little piece of tissue and sending it to pathology, and I look through the microscope. And that's pretty much what I do all day long, is look through the microscope and tell people whether they have cancer or not. Now, what I'm here to talk about is HPV cancers, HPV and cancers in men in particular. A lot of what I do has actually been, my research has been about HPV cancers in women. And you've heard a lot about HPV because it's HPV and cancer, cervical cancer, anal cancer, laryngeal cancer, oropharyngeal cancer, penile cancer, cancers we don't talk about. There's a large spectrum of cancers in both men and women that are due to HPV, and those cancers are now pretty much totally, more than 90% anyhow, preventable by HPV vaccination. So we've been here a couple of hours, right? And to put it in real terms, in the 2-3 hours we've been here, 3 to 4 women have gotten cervical cancer, and more than one of them has died of cervical cancer. And most of those women never had screening, right? So they never went into for a pap smear or an HPV test. Today, almost all women who get screened should have pap smears and HPV tests. Now, in men, the same number of men got cancer due to HPV in that time frame in the United States. But there's no screening in men because screening is driven by how frequently cancer appears in the population, and the numbers just don't work out. You can't screen all the men, even though for every woman with HPV infection, there's probably a man with an HPV infection. And men get, as I said, penile cancer, they get anal cancer, and they get cancer of the head and neck, so much cancer of the head and neck, in the mouth going down into the throat. Those cancers were over when I started practicing pathology, none of them were caused by HPV, right, or very few. They were all caused by smoking and drinking, readily modifiable risk factors in the population. Today, more than half of the head and neck cancers that we see, particularly in men, but also in women, are due to HPV, and not so much due to smoking and drinking. Now imagine, if you will, that every hour or two, those people who got cancer and that person who died of cancer didn't have to die of cancer, right? And the reason they didn't have to die is because when they were young, when they were 11 or 12 years old, before they started becoming sexually active, their parents took them to their family practice doc, like Nancy, and they gave them the HPV vaccine. And that HPV vaccine has been proven in both men and women to be more than 90% effective, in some cases 98% effective for cervical cancer, in terms of preventing the cancers that are due to papillomaviruses. And there's a big benefit as well in that for young people, they don't get genital warts anymore. And we know this works, and we know it works unequivocally. I often get asked, why is twice as many women or girls getting HPV vaccines as boys? We started earlier because we had to prove that such a vaccine would work. We never thought it would work as tremendously well as it did. And so the first clinical trials were in women. They ended in the early 2000s and led to the approval in 2006. And then clinical trials could start in boys when you proved that it was effective, and that led to the approval in men in 2009. Now, I can't emphasize strongly enough, we're here to talk about the prevention of cancer. And this is the one cancer that we unequivocally can prevent if we would only vaccinate our kids. And in the United States, where the cancer was first licensed, where we've had the vaccine the longest, actually, in my opinion, should be pretty embarrassed by the way we don't vaccinate our children. You hear about this in the news in terms of vaccination for other infectious diseases. I mean, there's no doctor in the audience who's ever seen a case of measles, probably, and yet we have measles epidemics in California and other places. Well, for HPV, only 50 to 60% of girls have had the HPV vaccine, and less than 50% of boys have had the HPV vaccine. If you go to a place like Australia or England or some of the countries where they have truly organized health care and the access to vaccination is not a problem, 80 to 90% of the population has been vaccinated, and some of the diseases I'm talking about are starting to go away. So what does that mean? No more cases of genital warts in the family practice community. Half of the abnormal pap smears that we would see every day in the pathology lab in screening have gone away. And that's just the beginning, as we potentially could end up with a generation, as was alluded to, a generation with no HPV-related cancers, or so few HPV-related cancers. It'll never be zero. Nothing's perfect in biology. But we would have so few cancers that we would start having conversations in this country, as they already are in countries that have used the vaccine properly, start talking about stopping screening. Instead of initiating screening, we would talk about stopping screening in the population, because screening would cease to work because there wouldn't be enough cancer to screen for. So with that, I think I used up my 5 or 6 minutes, and be happy to entertain any questions.
Let me take that over now. That was great. Thank you.
Do we know or have any information on how long the HPV vaccine series is effective for?
So that's a great question. And that leads to another question, is why do we have to vaccinate adolescents? So we know that from the time of the first vaccination given in the clinical trials, no patient has developed an HPV-related lesion or disease related to those vaccine types. So that's over 10 years, right? So as far as we know now, at least 10 years out, nobody needs a booster. Nobody's going to need booster shots. The vaccine lasts a long time. And we're moving forward. We've been approved. It was approved in 2006, so you have 12 years of actual real-world experience. And from the clinical trials, you can push that back, another 5 or 6 years. So you're getting to the time of, the same level of experience we have with other vaccines like hepatitis, which we don't get boosters for. Perhaps because we're exposed, through normal sexual activity. We're auto-boosting. That's one of the theories as to why it lasts so well. It's also a very immunogenic vaccine, probably inducing some of the highest level of antibodies that we see in vaccination. So it lasts a long time. No booster shots that we know about.
Clinically, there's probably nothing we can check for.
No, so there's no screening. There's nothing you can do. What you can check for is that what you'll see is in your vaccinated population, when you start screening the women for cervical cancer, they won't have abnormal paps. And when you start, and you won't see genital warts, right? Because all the vaccines used in the United States have the low-risk HPV types that prevent genital warts, which is 95% effective as well. So you see it clinically, but there's really no way to monitoring it. That being said, there are long-term scientific cohorts that are being followed. They're in Scandinavia, where they can track people from, birth to death. And those are the monitoring cohorts. There's thousands of people in these cohorts. I actually read the biopsies that are done in those. And the only disease that develops are for disease against types that aren't in the vaccine. So great question.
My colleague Vic. But I really appreciated Dr. Sherman's theme of connecting the dots, and so just wanted to mention a couple of other resources. If folks are interested, on cancer.gov, NCI is supporting research on increasing the uptake of the HPV vaccine as well. And then also wanted to help connect the dots and let folks know, you hear many members of Congress today talking about their support for NIH and NCI, and that support led to the research that led to the HPV vaccine. Our Deputy Director, Doug Lowy, and colleagues in our intramural program, including John Schiller, helped develop that technology that led to the vaccine. So if folks are interested in more, you can check out cancer.gov.
Can you speak a little bit to the ease of transmission on this? Like, I'm not sure everybody in the audience understands that HPV is just like so simple.
So I am not a scientist, but I will hand it off to Vic to talk more about that.
That's a loaded question, to say the least.
But a couple of years ago, we had somebody present on this, and somebody in the audience said, "Well, that's pretty hard to get." No, I don't think so.
It is, and Mark can also chime in, preeminent HPV expert, but I'll just try to do justice by saying it is one of the easiest transmittable, sexually transmittable, as well as transmitted by skin-to-skin contact. A virus that is as ubiquitous as any other virus you can think of. About 8 out of 10 individuals will have HPV at some point in their lives. So it's not a virus that's, like HIV, which does transmit, but not at the same rates. This is one of the most frequently transmitted viruses, which is why it's important to vaccinate everybody and to screen people who have not been vaccinated going forward.
It's good to know. They have. That's why we do. That's why we do this, to connect the dots, as Dr. Sherman says. That's why we're here today, because we want you to be fully informed on these issues. Doctor, do you have anything to add
Yes,
to that?
I'd add to that, right? I mean, many of us who work in this field, I mean, they talk about HPV and doctors and patients don't want to talk about it because they think it's a sexually transmitted disease. HPV is part of life. Every person in the room has one or more, probably dozens of different HPVs on different parts of their skin. Now, the ones that cause cancer are highly associated with sexual transmission, but by the time you're an adult, if you've had sex, particularly if you've had sex with more than one person, the likelihood that you're going to have one of the HPVs that is worth vaccinating against is very high, especially now that we have a vaccine that covers 9 different viral types in one shot. So it's very transmissible, and it's so common in the population. That's why the entire population is recommended to be vaccinated starting before you're exposed. And that's why it's critical to get the message out between doctors and parents. It works best if you've never been exposed to HPV, and the types that cause cancer you're not exposed to until you start having sex. When we start having sex, 30% of 13-year-olds have already had sex, whether their parents want to admit it or not. So that's why the recommendation is to start between ages 9 and 12.
Does anybody else have any questions or comments here? Dr. Sherman. Here we go. No, come on up.
So just to follow up, I'm really interested in the anorectal component of this, and I think Tom was talking a little bit about that in the HIV population. But going back to, and that's because I'm a gastroenterologist, just want to qualify that. But the other side of this is you were talking about the age. The optimal age is 9 to 12?
Yeah.
But what about for people in our age group? I won't lump you into my age group, but because it's clear you're younger than me. But what is the cutoff?
I would doubt that. So
should everybody get vaccinated?
Well, so that's an area where we're talking about research and where we would go off label. What we know is, and this is where population dynamics gets complex. We know if you haven't been exposed to, let's say, HPV 16. HPV 16 is the one virus that is responsible for 50% of the cervical cancers, 90% of the anal cancers, 90% of the head and neck cancers that are due to HPV, right? So that one virus alone, if you took that virus out of the population, you'd have a dramatic, right? Half of the cervical cancer on the planet would go away, right? 90% of the anal cancer on the planet would go away if everybody was vaccinated against HPV-16. Problem is, you have to get it before you've been exposed. So if you're lucky and you haven't been exposed and you want to get the vaccine, then for the price of a couple of nice dinners out, you get the vaccine, and you'll be just as protected as a little kid, right? But if you have been exposed, in a way, it's too late, and then you have to go into the screening program to prevent cancer, which can also be incredibly effective.
I just had one quick question before Representative Beyer about if you're supposed to get 3 shots and maybe a kid only got 2 shots, but you find out in their 20s they only got 2 of the 3. Do they get the 3rd shot? Are they good with 2? What do we do?
So this is part of the evolving data that Vic was alluding to. So when the vaccine was licensed, it was licensed and the data were for 3 shots to get sufficient antibodies to protect. Then they did studies in Canada and elsewhere, and they showed that if you're young, right? So you talk about being old, right? So a 20-year-old is very old compared to a 10-year-old. A 10-year-old kid will make 10 times the amount of antibody that a 20-year-old will, and the 20-year-old will make 10 times the amount of antibody that a 40-year-old will, right? So it was shown that you can give 9 to 12-year-olds the shot with only 2 doses, and they'll get the same quality of response as a 15 to 25-year-old. So the current recommendation is for young kids now, they don't need 3 shots anymore. They only need 2, which makes it very easy to do. But if you're over 15, you need 3 shots.
No, I've tried to resolve this. I had one kid where they're like, yeah, they got 3, the other one 2, or 1. I forget, but I was like, maybe I was taking the dogs to get shots. I don't know how I screwed up, but I was like...
The other part of it is if you actually don't know and can't keep track, it's not dangerous to get an extra shot, to get an extra booster shot.
Even if you're an adult, then?
Even if you're an adult.
Really?
Yes.
Okay, because
So they did the trials. So the first vaccine had 4 viruses, Gardasil, right? So Gardasil was given, and then they came back and gave people who got Gardasil 9, a full course of Gardasil 9. And yeah, they got a sore arm because it's a great vaccine, but nothing bad happens to them.
So as a young adult who might be sexually active, it's okay to get that additional shot?
If they want it, but it's not going to be recommended as a public health policy.
I gotcha. I understand. It's not going to place them in harm's way.
No.
So we have to...
Thank you.
Thank you so much for being here. You've really answered so many important questions. Thank you very much.